Let's look at the medical management of obesity. Right now, Health Canada approves 3 drugs for the treatment of obesity, and let's go through them. The first one, the oldest one of them all, is Xenical, also sold as orlistat. Its main mechanism of action is actually it inhibits the proper absorption of nutrients. So the side effects are often diarrhea, abdominal bloating, cramping. It's the oldest one of the 3. It's maybe the least well tolerated as well. Perhaps not the best choice. It's been on the market for a long time and it didn't make any waves. The second one, and partly newer, is Contrave, which is a combination of bupropion and naltrexone. Bupropion is antidepressant that's been on the market for a long time, and one thing we noticed with time is people who happen to take it did tend to lose a little bit of weight. The key word here, I think, is a little bit of weight, because it doesn't do miracles. The Contrave company says it's better when mixed with naltrexone. As an antidepressant, the main side effect it often has is it causes headaches and a bit of insomnia. Its success rate is actually not that great, as 50% of, or up to 50% of people can be non-respondents to the drug when they do take it. But when it works, people are usually happy about losing weight. The third one, and I think this has been the most revolutionary of the drugs to treat obesity so far, is liraglutide, or Saxenda. Initially, this was conceived as a diabetes medication. It's a GLP-1 agonist, and it works mainly by inhibiting hunger and making you feel full even after smaller meals. The side effects are often nausea. Up to 30% of people can report nausea, so this is pretty frequent actually, or vomiting. Up to 7% of people can have vomiting with this drug. Even though this is a diabetes medication, the risk of hypoglycemia with this is actually pretty low. So Health Canada actually approves this in non-diabetic obese people as a primary treatment of obesity. In terms of efficacy, I have to say this is perhaps the most effective of the 3 so far approved. Success rates go up to 95%, with 5% of people reporting treatment failures, but overall this does seem to be much better. And now a quick word about 2 drugs that so far are not approved but can be considered, or at least discussed. The first one is semaglutide, or Ozempic, closely related to liraglutide, but with the advantage of being once weekly injections. There is high hopes, I think, so far that this may eventually get approval, but so far it hasn't received it. By the time you watch this video, maybe semaglutide would have been approved. The other advantage is that it does have an oral form, so that's also very interesting for people who don't want to poke themselves with liraglutide or Saxenda needles. And the last one to discuss or mention is Vyvanse. This does have approval for binge eating disorder, so if the obesity is at least somewhat linked to binge eating disorder, then it can be considered. It is a psychostimulant used to treat ADHD. Of course, being a psychostimulant, the risk of abuse is also there, and without any binge eating disorder, there really is no indication for this. So there you have it. This is the pharmacological treatment options for obesity treatment. By the time you read or watch this video, this may have all changed, because this is obviously a very fast moving field, but hopefully it puts you up to date.